My presentation is about early education on mental health for junior high and high school students and how early education could help destigmatize mental health, therefore increasing the proper treatment needed for adolescents with mental health disorders. One way that I would do this is by implementing a curriculum change for junior high and high school classes, which would incorporate mental health classes in with the regular curriculum such as math, social studies, and science, therefore not making it elective and it being mandatory for every kid to go through one, if not more, mental health classes. This would be beneficial for them because they can learn more about signs and symptoms and ways to help treat it, to help them either focus more in school or make them feel better in general. It would just be very beneficial so that kids could have more of an understanding as to what might be going on in their lives. Junior high and high school students are at extremely high risk for being misdiagnosed and undiagnosed for a variety of mental health disorders such as anxiety, depression, and even ADHD, which once they take these courses, if they see symptoms that might relate to them, they could then take the steps in which would require them getting proper treatment, such as being on medications or talking to a therapist, getting their family involved, which would be positive side effects of adding the curriculum changes. Also, what could be added is after-school programs, such as group therapy sessions where it's other kids around the same age coming and talking about their problems and things of that nature. Another way that early education on mental health would be beneficial is to get the parents involved earlier rather than later, and as well as getting the teachers involved, that way that they can help in any way that they can as well. With this, we need to break the negative stigma and the negative cycle of how people view mental health, as instead of it being a problem to be avoided, it needs to be a situation that can be improved, which will then later help these junior high and high schoolers carry on the positive characteristics and traits dealing with their mental health disorders through college and the rest of their lives. The picture on the presentation says that 10% of children and young people ages 5 to 16 years old have clinically diagnosable mental health problems, yet 70% of children and adolescents who experience mental health problems have not had appropriate intervention at a sufficiently early age, which is just another point to prove that the early education for mental health for junior high and high schoolers is extremely crucial and important to how it affects these kids once they grow up. They are able to manage it and deal with it at a younger age so that it's not a problem going forward in life. The community that I chose to do our community assessment project on is Mason, Ohio. I chose this because it's relatively close to my house and it's completely different from the last windshield survey that I did. Mason is located near Kings Island and has roughly 33,000 people in it, so that's a rather big community because I think it's only maybe 19 miles total. The top 3 community strengths in the Mason area are increased public safety, so police patrolling, high employment rates, and low percentage of teenagers who use tobacco, marijuana, and or alcohol. On the other hand, the community weaknesses are a decreased number of women's health needs being met, such as yearly mammograms and pap smears that are suggested for women, increased obesity, which in the Mason area is actually at 66% for obese and overweight. And the last one is decreased quality of water and air due to pollutants, which seems to be a valid problem because it's a highly populated area that has a lot of traffic. But the problem that I'm addressing for this project and this community is early education on mental health in junior high and high schoolers in order to help decrease the negative stigma that surrounds mental health issues. And then with doing this, it can also increase the amount of treatment that is sought from kids this age who suffer from mental health illnesses or disorders. The end goal is that by initiating early education, it will help students become familiar with the signs and symptoms and comfortable with reaching out for help and getting the proper treatment needed. The objectives for this project are to increase early education by adding mental health to the curriculum, and this would be evaluated by pre- and post-education surveys to see if their knowledge has increased or there's a better understanding of mental health after taking the course. Another objective is to encourage open communication between students and staff so that they feel comfortable reaching out if they have any concerns or if they need any more information. And this could be solved by having either before or after school groups, so where they can meet and have a safe place to talk, and it can either be with just students or students and faculty or just faculty. And then my last objective is to try to involve parents or guardians, to try to keep them involved in the student's care and diagnosis, to also help facilitate healthy coping mechanisms and understanding on the child's part and the parent's part. This is also going to help with medication adherence, and then the parents could also identify any possible mental health changes in the future, and this would be evaluated by meeting with the parents one-on-one to gauge their involvement in their child's health. Overall, what I learned during this was that even in the wealthier, popular communities such as Mason, there are still everyday problems that they face, and these problems can have solution if the community takes the time to acknowledge that there's a problem and initiate steps towards improvements so that the students can thrive after all of these have been initiated and their mental health is better taken care of.